in our herbalism, we can cure the thyroidism, we can cure the BP, we can cure so many ailments we can cure. But even sugar also, diabetes also can manage easily without subjecting other problems. We can manage their health doubts and questions. Then I will clarify in my level best.
You've given a very good picture about how we can involve in the social development in all the 5 aspects of development. Very nice one. Yeah, I truly agree with you that health is the primary concern of the society. Of course, it is to be supported by financial health also, as we understand today. So how do we, and another very important aspect that you are touching is about women and child.
Yes.
Are the two most vulnerable subjects in the society, both in the aspect of physical mental health, also in the aspect of financial health. So if we can empower women by their health in all aspects, 5D, developments, I'm very sure the society will be a flourishing one. And NCN can be the best platform for any such kind of activity which empowers people. So that's what I understand by your interaction with me all these years, and right now you are presenting. Let me listen to what Father Edwin has to say.
One second, Raji.
Yeah.
Joseph Ratnam sir, he opened my eyes.
Hmm.
In one day class, he explained, we discussed everything. Joseph Ratnam sir, we conducted one camp here, one program here, That day I come to know who is the main people behind the drug mafia, how they are ruling the world, how they are cheating our less illiteracy population, and how they are making money. This is very, very big project they are designing to cheat the people and to foolish the people and getting the money. Now, what I designed my company, Guruji, very well. Now I can sacrifice. I can sacrifice. I given myself to the nature to give service. If you enroll this system like this, now for that 5% also, what I am taking for run this concept only, and remaining all money goes to the other chapters. The people yesterday, I conducted meeting, Father. 12 people joined. All 12 people are NGOs only in Telangana and in Andhra Pradesh. Today morning, after this yesterday's meeting, 4 people called. Sir, we are get ready. In Andhra Pradesh, we have one association, doctors association. We will come and join with you. And other people also. 3,000 people. 3,000 people to start. If it is run like this through health sector, if you start this program, all other issues plus health, if you conduct together, he get ready to join with us. And if you design a project and a program, and he will take care of 2 states, like that he said. And already he got some 30 acres of land. That land also, he is ready to start one building for NCN in Hyderabad. And already I told I am also donate for NCN building to conduct this project in my land in Bangalore. I am also, we will going to construct one building like that. Let it be the Bangalore is the headquarter, and remaining places, let us start our branches. Srinivas Gowda sir said he is also, we will start in Vijayawada. Like that, big people are involving here. First, we want to start one project, Neighbourocracy project, adding one health subject also.
So today I was in Madurai. There's one society called Sneha. They are working in 2 or 3 districts, coastal areas in 2 or 3 districts around Nagapattinam, Kadalur and all that. And then they are in existence for nearly 35 years, I think. And I happened to be his first president. Then I said I would not continue as the president. Then I was keeping aloof. And now they are calling me back again for various consultations. And today they called me. They asked me to explain about your sociocracy and neighbourocracy and all that. And then they want to go for it in a big way, starting with one panchayat to develop as a model. That they will not stop with one. So they want me to go and conduct for them again a 2-day program on the nitty-gritty and so on. That will come in September. If they enter, they do things systematically, and then they will push the program one. And they have also health component, children's component, marketing component, and everything. So all their expertise and experience will come to strengthen neighbourocracy around those areas. Now, that's my check-in. So what I did today, then I traveled back. So after going there, I feel energized and younger. And then what happens with regard to this program, it comes in 2 of 4 categories, mainly, of course, in more categories. We are supposed to have one health department. That means each neighborhood having a health minister. And these health ministers are to be federated at village level, panchayat level, block level, district level, state, national level, and gradually international levels. But somebody has to be at this. Now, so far, we have been attending more to the promotion of the concept and organization. Now we'll have to strengthen these departments. So to strengthen this department, if somebody can volunteer, there could be a one good advisors group or promoters group or animators group or resource persons group, then if there is one group like that, it would be wonderful. Through those ministers, the responsibility of this group will be to motivate, strengthen, guide those ministers' groups so that they remain energized and supported. Once they feel they have some support, energy, and direction, they will be trying. With health alone, we could try to animate the whole movement, because health, as Dr. Balakrishna himself says, is, according to WHO, not merely the absence of disease, but a state of physical, mental, social, and spiritual well-being, which is the fundamental human right. That's the WHO definition. That way it covers everything. But still, there could be a health minister. Though the health communities, the neighborhood committee is supposed to be for the total well-being, still there could be someone focusing that on progress towards total well-being from the point of view of what we call health, which could be preventive, herbal, alternative, whatever. And so that if some group can come up, if they could only organize these health ministers, it would be a big support for the movement. One. Then secondly, we are also interested in a kind of a marketing component or a business component. I have written a booklet, not a booklet, a kind of an article or a chat session under the title Marketing from Below. So my vision, there should be one marketing person or a marketing ministry of 2 or 3 people in each neighborhood. And their role, hello, I'm in a meeting. You're welcome. Okay, good, yeah. Okay, and then what happens? These people, their role is business. Business means they try to take every week a kind of survey in each neighborhood of 30 families. and the buying needs of that neighborhood unit of 30 families that week. So this week, for these 30 families, we need this and this and these things. And then so many 30 family units that way in a village or in a panchayat or a block, a mandal, they all link together. So I was giving the example of Kanyamar district. We are already 5,000 such neighborhoods. And then in each neighborhood, if somebody is, if the 5,000 neighborhoods buy together, that is 5,000 into 30 families means 150,000 families. Into 5 people means 750,000 people. And that's a big buying power. And if these people can buy things together, organized, that they create a marketing network among themselves through which they could buy straight from the producer or produce things themselves and have their own line, marketing line. No, all these families supposed to be marketing line. Then they will have economic power. That means such a lot of benefits. One thing, they can buy good quality things at a reasonable price at their doorsteps, and then with profit shared among themselves. And they could give employment to people, and they could encourage entrepreneurial initiative. That means they could start producing. Because normally what we say in NGOs, you see, we already started those days. We had a kind of an NGO, and Darwin knows that. Basil also knows that. We started producing, masala powder and various things. And they said good quality, but they will not sell because markets are already under the control of big sellers. And so without a market, we die. So we said, instead of begging for the market from those people, why not people themselves become the market? They buy, they sell, they produce this way. And for that, they need a structure. And we have this neighborhood structure. So when we bring this, what happens? There is money power in the group. And when money power is there in the group, everybody takes the group seriously. Okay. And then they have bargaining power. And they can have increased political power. I mean, not for the present day political party system, but for their own governance. So such a lot of possibilities are there. So one possibility is to approach as health ministries. Another approach is as marketing ministries. What I told people here, you don't need to start with plenty of products. You begin with 1 or 2 products. Then you gain confidence. Add 1 or 2 more products. Buy and sell. You gain still more confidence. Gradually, it could become a new culture of buying and selling and producing. And this way, if we start doing, gradually we could aim towards what Gandhiji was saying, self-reliant republics. Self-reliant republics means we would say whatever can be produced, whatever you can produce from the nearby places, you produce and buy from there. Only whatever you cannot produce, you take from faraway places. This way, a kind of self-reliant economy. Self-reliant economy means now we know what happens. The present day marketing is distant type of marketing. Initially, we may have to go that way because of compulsions, because they bring far away from their place. So people at the locality, they have no control over production, no control over buying, and selling, and then they'll have to spend such a lot of money on this petrol and then vehicle and all that. All these things can be reversed, and gradually the people could have more power, and that way more governing possibility, and then they could solve their problems. Okay. So these possibilities, one, going through this health ministry, one. Another one is marketing ministry. If we could start in each of these neighborhoods, these two ministries to begin with, it will mean a lot. Then, as we say, Balakrishna is giving some products. That's a good initiative. Like this, when you organize the whole nation, more and more people will come and say, we shall help, we shall help, we shall help. Then it becomes a big movement. So, welcome to the initiative, Balakrishna.
Sister Basil, your turn.
Of course, it's a good thing. As specifically, when I heard about this herbal-based medicine, I'm very much impressed. Because one of my students also had done some work on the blood clots in the blood vessel, no? So we could find something from the plants. So if Dr. Balakrishna is willing to provide such kind of things, and if we succeed in promoting that through our neighborhood, it will be really wonderful. I am very happy about the thing given. Actually, there's a Father Edwin had started this initiative long back in the form of Balamai Trust. It was really functioning well, but we could not proceed further. I think the power will really come to the people and we can do something great. Thank you very much.
So nice. Darwin.
Oh, it's a wonderful initiative. Again, actually, again, the central government and other governments are insisting on the Siddha and Ayurveda. It's through herbal, it will be useful for the people. Really, it will benefit the downtrodden people and things. Since the medical expenses are very high, it will be a low cost thing. Again, the business plan is very good, mutually benefited, especially the person who is initiating the thing, and everyone gets benefit out of it. It's a scalable one throughout the India or other countries also. We can able to scale it up. Again, honestly, doctor should explain a little more about the authenticity and the certification process and other things which he is already having. And again, what will be the next step of getting other aggregation and other things, so that people believe in the medicine and buy the medicines. Father mentioned neighborhood. If we really push as a marketing thing, we can able to succeed within a short span.
Yeah, I understand. Fantastic. I would like to say something at this point. One is about medicine or a treatment, large number of people. The second is financial strength that we build in the society. Okay, these two things, like I find with both Father Edwin's and Balakrishna's proposals, and also adding on to it with the Basil and Darwin's points. One is we need a structure. Anything to do, we need a structure. So the structure should be an inclusive structure. That means it includes everybody. And another thing is, everybody not only included, they also participate fully and their voices are heard. This is the most important way the structure functions. So one is the structure and the way it functions. We found Neighbourocracy is the big structure. Sociocracy is the most effective way of operation in the structure. And there, whatever you put, whatever is genuine and whatever is most suitable for the people, that will be adopted and it will be automatically flourish. That's how it goes. I saw this proposal of Dr. Balakrishna as the most genuine and simple way, because I find 95% of the profit goes to the society. This is the most important thing. Normally, when we pray God, a lot of people, I don't know all of you or anything, but we pray like, I will give you 5% to you and give me 95%, or 2% to the society and remaining is mine. But here it is the other way. 95% we give to the society, only 5% we keep for ourselves, for our running expenses and all that. And that is the best way any social activity can be conducted. So very few people will be really willing to participate, or very few entrepreneurs will be willing to do that. But here we have a proposal. I am very sure that this will be very helpful for the people. And from my side, I definitely tell Dr. Balakrishna's products, which I have used, and even my wife is using. We are given to Father Edwin and other people and many people. It is really doing miracles. It's because it is simple and most fundamental requirements of a human being. So once you provide those things, body takes care of itself. So this is the principle that Dr. Balakrishna is adopting in all his treatments and in his products. And he has done a great research in finding out the best of the ingredients for the products from anywhere. If it is from India, if it is from another country, it doesn't matter. But he has brought it to the availability so everybody can make use of it. That's how he has made his point in the whole medical field. We are very happy and fortunate to have such a wonderful soul with us, and he also need to adopt the way that NCN functions. So in this neighborocracy principles, I'm very sure that such a genuine products and such a genuine treatment is very essential for every individual, and it will reach definitely. So this is my point here.
Basal madam's requirement means it is the society requirement that cardiovascular arteries blockages, it caused due with some toxins and cholesterol and some impurities nothing but sludge, the salt, toxins, and with sludge, plaque obstructions will built in the cardiovascular system. It is possible by using some herbal phytochemicals. Phytochemicals very easily within 3 days it will disappear. For that, the people are doing angiogram, angioblast, and all. No need. It is like a common cold. A common cold will disappear in 2 to 3 days. Some blockages also happened in the nostrils. That will be automatically it will be removed. Like that, it can be removed like common cold within 3-4 days. We did some miracles. Our system. I will give one fine example. One of our associate doctor, he asked me some problem with his patient. He already admitted in the hospital. They said he should go for under surgery angioblast and special system. It will may cost 6 lakhs rupees. He has to stay in their hospital for 3 days. I said, ask him to come here within 3 days without any charge. Just worth of 600 with 600 rupees, it will be removed. I challengingly asked them. He discharged and came and had taken our supplement. Now he is very healthy and all that blockages removed. Like that, it is possible, madam. Basil, madam, it is possible, and we are going to provide health awareness programs. Through this program, we will discuss how to they maintain their regular diet, their food habitation, and some yoga and meditation. If you implement this in our programs, by doing some meditation and changing little changes in their food habitation, all people will become so healthy. And in this health program, they will get money also. Very easily they will get money also. All chapters people they will become business entrepreneurs also. For their living also become very healthy and happy. What I applied this formula in my association, everybody is very happy and very healthy. Raviji knows this implementation. Let us apply through our NCN to the mankind, to the nation.
Okay. Now, Sister Basil, she has guided some 17 doctoral dissertations as a guide. Then her friends, they have also guided both through zoology department and botany department and so on, and identified certain cures for cancer and so on. And those things need to be marketed. And then they have not begun the processes, I think, but slowly. I like this. We could link with various academic institutions too, to see how best their inventions could be made in the actual concrete benefits for people. One, today they gave me this one. This is Pudina Kottamalli Tokku, made by people themselves. Now the demand is so much for this. They said with their normal ways of producing, they will not be able to meet the demands. So they want bigger machines now. Because so far they were managing with this usual their kitchen type of items. And they said with that they cannot. So they are on for a bigger expansion. And then this is Pudina, Pudina, Kottamalli, coriander.
Yeah.
They give it for eating, so both medicinal and food. And another one is here. They gave me some samples. One is Pirandai. Pirandai means some kind of creeper, the square-like shape.
Oh, yeah. Nagaman. Something.
This is Pirandai. Made some tokku. Tokku means something they use for ordinary meals as a kind of appetizer or so. One. And then there is another one. They are from a coastal village. Dried shrimp powder. Shrimp, prawns, dried shrimp powder, they are producing. So this kind of markets, they said there is a market now they are not able to produce. So this kind of empowerment can be promoted through this neighborhood structures.
Darwin Most.
Yeah. It's a wonderful thing to go ahead with Raviji, and the thing is, it will get mutually benefited kind of thing. As far as from the presentation I am hearing from Doctor, it's a workable thing, and again, actually, how we are marketing that plays a vital role, and again, we can do it. Yeah.
Actually, it's a very good thing. Here also near one area, that's in Kanyakumari district, the transgender people, they are preparing some karvappala tokku. That also they say highly medicinal. It helps heals many diseases. And if we train those people, they will really work hard, because normally they go for begging. Now, if you are able to provide some job facility, they will be very happy to cooperate. So I think that way we'll be able to find people also to join with us and carry out this. Okay, I'm very happy about Dr. Balakrishna's view, because I also really believe in the herbal medicine than in the allopathy. And if you are able to do something through this, it will be really good. Also, as Father said, we have few lectins, which can be developed as maybe as medicines, or at least something to find out cancer, to diagnose cancer. It will be good that in due course of time, I think we can discuss with Dr. Balakrishna and find out later on. Thank you.
One thing is are we promoting a particular business? Second thing, are we promoting a particular medicine, or are we promoting a method of evolving in such a way that people will be promoted, not the medicine, but the people will be promoted to develop and understand first health, what is health for them. Second thing is how to find the best remedies for their health situations. So this is one of the things that if we can look into, I'm very sure that we will be able to provide the intelligence of people like Dr. Balakrishna, and also some of the research work they have done, not just today's work. It is a research done over a long period of time. Almost 20-30 years of their research has come in the form of these products. So people can make use of that knowledge and wisdom. So this is how it is. Like, I met a lot of people in my life, like Dr. Balakrishna is one great soul I have met. But there are other people also who have many things to offer. So what I do is I bring them together. So they will see what actually is the best for particular remedy. So that they will, because they are focused mainly on health, and when they come together, they will see how best and at the lowest cost people's health can be taken care of. So this is mainly what I have seen with the Dr. Balakrishna kind of people. when it comes to neighbourocracy as our mode of operation, we need to see how every, like, we have to envisage the idea, like how at every point of the place, like every neighborhood can get these remedies available. Okay, not only with health, like right now we are focusing on health, so let us focus on it. So how are we going to provide those remedies? The second thing is, how do we educate people on the aspect of being healthy? What are the healthy habits? Like not just food eating habits alone, other habits. All these things are to be taken into, and if there is a like Balakrishna kind of people who are completely dedicated to the health of the society, then that is very easy, because we can just approach them, they will take it up, they will discuss about it, they propose these things, and then that can be given to the people for their own life to adopt, because it's a special field, it is required. We were all these days we were thinking health is some some foreigners or some other country or some medical mafia will take care. Now we need some people genuinely interested in the health of people come together and take care. So this is my only concern in this aspect. We have to sit very seriously together to plan up and build these structures. Very important. This we may have to give some dedicated time. Sitting with people like Dr. Balakrishna and others, like he is going to invite other people also who are doing a lot of work in this field. So we can take their, like you can also invite other people who have got a similar kind of interest. So there should be a brainstorm on all these things, and then we have to work on it.